All right, hello, welcome everybody to Phoenixville Public Library, those of you in our community room and those on Zoom, to our Medicare 101 presentation tonight from Gary Davis, who is a counselor with PA-MEDI, and Gary will tell you what that's all about in just a second. I mentioned earlier that those of you on Zoom will be getting an email from me shortly after the program tonight with all of the handouts from tonight, including all of the slides. And actually everyone who signed up for the program will get that as well. There'll be different points along during the presentation when you'll be asked if you have questions, and at that time those on Zoom can either unmute yourself or type in the chat. All right, without further ado, Gary, take it away.
Okay, thank you, Mark. Thank you all for joining us, those on Zoom as well as those here. This presentation is Medicare 101, the basics, so it's really geared towards people who are going to be new to Medicare. As Mark said, I'm a counselor with PA-MEDI, which is a service of the Department of Aging in Pennsylvania. So specifically, I'm a volunteer with Chester County's Department of Aging. PA-MEDI is the name of Pennsylvania State Health Insurance Assistance Program. All 50 states have a similar program. Each one names it something different, but all states have this same service. It's a free, independent service to provide help with Medicare and related topics. All the counselors, such as myself, were certified and trained volunteers. Okay? And that's important because as a volunteer, our goal is not to sell you something. One of the things you're going to learn tonight is you have choices about how to get your Medicare benefits. Good. Thank you. So as volunteers, we don't have any financial interest in trying to steer you towards one option or another. Our goal is to educate you, to understand the options, the pluses and minuses of the options, so that you can make a well-informed decision for yourself. In addition to doing presentations like this, we're available to help you throughout the year. One of the ways to reach us is for an appointment. You can set up an appointment with a one-on-one meeting with a counselor at any of the senior centers throughout Chester County. That's one of the handouts you'll be getting for those on Zoom when Mark sends that out later. Those here have that. A lot of people who are going to be new to Medicare find it helpful to attend a presentation like this first and then schedule a one-on-one appointment with a counselor to fine-tune your questions, your selections, and get whatever help you need enrolling, which is what you guys are doing next week. The other thing is we have a helpline, 610-344-5004. Option 2. That's available throughout the year. Maybe you just have a quick question or need some direction about where to go, who to talk to on a Medicare-related topic, and you can call that number anytime. Just leave a message. A counselor will get back to you within 24 hours. Here's the agenda of what we're going to talk about. The first 4 bullets are really about the insurance itself. Parts A and B of Medicare, and then we're going to talk about Medicare supplements. Part D, which is drug plans. Part C, which is advantage plans. We'll talk about all those. The last 2 bullets, the 5th one talks about how and when to enroll. It's very important to enroll in the right enrollment windows so you don't have late enrollment penalties. We'll get into that. And the last thing, there's some special issues for people who are going to be working past 65 and still covered by a group plan. We'll touch on that as well. One thing to touch on here is just some terminology. There's often confusion between Medicare and Medicaid. Medicare is a federal program which serves as the primary health insurance for most retired seniors. Medicaid is a state program, partially funded by the federal government, but it is a state program, to help people who have limited income and financial resources with their health care and medical bills. Tonight's presentation is about the federal program Medicare, not Medicaid. What is Medicare? So it is a federal health insurance program. You become eligible when you turn 65. You may not need it then if you're still working and have group coverage, but you're eligible. Some people become eligible younger than 65 with certain disabilities. End-stage renal disease, ALS, makes you automatically eligible. And if you've been on Social Security disability for 24 months, you're eligible for Medicare regardless of your age. You do have to be a citizen, green card holder, a member of a certain list of immigrants in order to get Medicare. This is an important slide. We're going to come back to this several times tonight. It's the roadmap. Each one of these boxes you see, we're going to drill down into and explain. But in addition to showing you those boxes, it also shows you a fundamental decision you're going to need to make when you sign up for full Medicare. And see that big "or" in the middle? That's the decision you're going to make. Do you want to get your benefits along the left-hand side of this slide, which we're going to call the original Medicare path? Or do you want to get your benefits on the right-hand side, the Medicare Advantage plans? Okay? It's a choice you have. It's a choice everybody has when they sign up for Medicare, and they can change that. We'll get into when and how you can change that. But as we go through these different boxes, listen to the pluses and minuses of each of these boxes. It might help form in your head which side sounds like it might be a better fit for you. It's very much a personal decision. There's no right or wrong here. So we're going to start off on the left-hand side. So we're going to talk about original Medicare option. Okay? Well, the first part of that's going to be parts A and B. But one thing that distinguishes the original Medicare side is that there are no networks. There's no networks of doctors and hospitals. You can go to any doctor, any hospital in the country, as long as they take Medicare. All hospitals do, almost all doctors do. So you have maximum flexibility on picking your providers, and you're also covered if you tend to travel throughout the United States and spend time elsewhere. Your coverage is as good, in California as it is anywhere else. Okay, Part A and B, the two main parts of Medicare for the health insurance part anyway. A is the hospital coverage. It covers you when you've been admitted to a hospital, not just in the emergency room for a couple of hours, but you've been admitted. So it covers the hospital stay, including psychiatric hospitals. It covers skilled nursing, which is often required after a hospital stay for a while. It covers hospice services and blood while you are inpatient. Part B is the outpatient medical insurance. So this is used much more often than Part A. So this covers when you go to see your doctor or a specialist. It covers lab tests and x-rays or MRIs, CAT scans that you get outpatient. It covers preventative care, ambulance services, occupation and physical therapy, all this kind of stuff, durable medical equipment that you may need from time to time. Now here's some services that Medicare, original Medicare, does not cover. It doesn't cover most dental care. It doesn't cover routine eye exams and corrective lenses. It does cover diseases of the eye, so cataracts, glaucoma, macular degeneration, those are all diseases, those are covered. What it doesn't cover is, I go get my eyes checked every 2 years to see if I need a new prescription. Okay, it doesn't cover that. Now, for some people, it actually covers those. For example, someone with diabetes may need to get their eyes checked more often, maybe every 12 months or something based on the doctor's recommendation. In that case, those would be covered because it's a medical requirement to treat a medical condition. It doesn't cover hearing aids or cosmetic surgery, does not cover long-term care, and does not cover foreign travel. Now let's talk about the cost for Part A and Part B. Medicare was never intended to be free. People always had to pay some for it, and that's what we're going to talk about here. Let's talk about Part A first. That's the hospital coverage, right, when you're admitted to a hospital. It shows you the monthly premium here can be $0 up to $565. Most people pay 0. If you or your spouse have worked for a total of 40 quarters, equivalent of 10 years during your life, and paid normal payroll taxes, then you have paid up for Part A and your premium will be 0. Okay? There's a deduction called FICA on most pay stubs, and that's paying for Part A. Now, if you didn't have those 40 quarters or a spouse didn't have the 40 quarters, you could have a monthly premium as high as $565, but very few people have that. Now let's talk about the deductible for Part A. Deductible meaning you have to pay first. That's what a deductible is. So if you're admitted to a hospital and you have original Medicare, you're going to have a deductible due of $1,736. It says per benefit period. And all the numbers I'm going to talk about tonight are 2026 numbers, okay? And these numbers change every year, and they don't go down. Okay? So 1736, whether you're there for 2 days or up to 60 days, it's that 1736, okay? You're covered for up to 60 days. And the way it works is, if, let's say you were in the hospital, you went in July 1st, you had pneumonia, you were there for 5 days, you went home. 3 weeks later, you're readmitted for something totally different. Doesn't have to be the same thing. You're not going to be charged another $1,736 because you're within 60 days of that first admission where you paid a deductible. Okay, so it kind of covers you for 60-day windows at a time. Now let's talk about cost sharing. As you can see, the cost sharing for a hospital stay is 0 for days 1 through 60 because your deductible covers that period for you. Okay? But if you're in the hospital longer than 60 days, then there is a per diem that's going to kick in. Okay, starting at $434 per day for days 61 through 90, and then that doubles for days 91 through 150. The last thing in that column is skilled nursing. Oftentimes after a hospital stay, particularly a lengthy one, you may need some time at a skilled nursing facility before you're able to go home. So with Part A would cover that with 0 copay for up to 20 days. If you needed more than 20 days, then you would pay $217 per day for those days over, starting on 21. Part B. Part B is the outpatient. Go and see your doctors and lab tests, all that. There is a monthly premium to pay for Part B. Okay? And the base monthly premium this year is $202.90. That's per person. If you're collecting Social Security, it'll come out of that. If you're not, they'll send you a bill for 3 months at a time. The deductible is $283 for Part B. So once you sign up for Part B, let's say you sign up August 1st, so the first thing you do, maybe you go see your doctor, maybe you get lab tests done, you're going to pay the first $283 of Part B bills that you generate to meet your deductible. After you've met that, then Medicare will pay 80% for the balance of the year, and you'll be responsible for 20%. Come January 1st, even though you just started in August, it's a calendar year basis, so come January 1st, there's a new deductible to meet for the new year. One other thing I want to touch on here is the Part B premium of $202.90. I said that was the base premium. Your premium could be higher. They look at your income from 2 years prior. So if you're signing up in 2026 for Medicare, they're going to look at your 2024 tax return. And if you're over certain thresholds, then you're going to be subject to a higher Part B premium. So the threshold for a single tax filer is around $109,000, and it's double that for someone filing jointly. So if you were over those thresholds, you're going to be assessed a higher number than $202.90, and there's actually about 5 steps higher over $202.90, depending how far above those income thresholds you were. Okay? You'll be notified of that if you're subject to that. And every year that you're on Medicare, they look back 2 years to see if you need a higher assessment for any given year. Okay, we talked about Parts A and B for original Medicare. Any questions on that, on what it covers or what it costs? Anyone on Zoom? No questions in the chat, Mark? Okay, we'll move on to the next block. As we just saw on that last slide, Medicare has costs to pay. There's deductibles, there's co-payments, out-of-pocket costs to incur. This next block we're going to talk about is secondary insurances that can help cover some of those deductibles and co-pays that we just talked about. Most people who choose original Medicare path choose to get some form of secondary insurance. It's not required, but most people are going to get some form of that. And that's what we'll talk about, some different options with that. One option might be retiree benefits from an employer. If you work for very large employers, the pharma companies, the drug companies, the DuPonts, the Vanguards, you may well have some retiree benefits available to you. If you work for the federal government or state government, you might as well. If you worked for the school systems in Pennsylvania, depending on how long you were there, you might have the HOP program as secondary insurance option. If you're retired military, you have TRICARE for life, which is excellent coverage. And there's a special note to veterans. Veterans can have VA benefits for health care and Medicare at the same time, but they don't pay for the same thing. So a veteran in that situation may decide to go to the VA for certain medical needs, and that would be covered by the VA benefits, and go to a non-VA doctor or facility for other needs, and that would be covered by Medicare. So you can have them both, but they don't cover the same thing. So if you think you may have any retiree coverage, definitely reach out to your current or past employer, whatever the situation is, and make sure you explore what option you may have, what it costs, and what it covers. For the majority of us who probably don't have retiree coverages available to us, we have the option to go and purchase a Medicare supplement plan. These are also referred to as a Medigap plan. So if you hear someone say Medigap, someone else say Medicare supplement, they're talking about the same thing. Okay. These are policies that are sold by private insurance companies, but they're there to help pay some or most of those deductibles and co-pays that we saw a couple slides ago for Part A and Part B. Okay. You can only purchase a Medicare supplement if you choose original Medicare, the left side of that roadmap that we saw earlier. If you choose an Advantage plan, you are not allowed to purchase a Medicare supplement plan. And as I mentioned, these only help with the costs for Part A and B, not with prescriptions. And these policies are sold by private insurance companies, but they're standardized policies. They have a variety of different policies available. As you can see, they call their plan just letters, Plan A, B, D, G, K, L. Okay, alphabet type name in here. But they're standardized, and what I mean by that, let me just pick a letter G. I'm picking G because it's the most comprehensive of the plans. It covers the most of those deductibles and co-pays. Not surprisingly, it's the most expensive. The more it covers, the more it costs, right? It's insurance. But there's probably 40 or more insurance companies that sell these policies in Pennsylvania, okay? But everyone who sells a G, it covers the exact same thing. And that's what I mean by standardized. The insurance company doesn't decide what a Plan G covers. Medicare already decided that. So if they're selling a G, this is what it covers. So as you're comparing which insurance company you want to deal with, you're really not comparing benefits, because if you decided I want a G or I want an N, it's going to be the same no matter who you buy it from, okay? And this is particularly an area where if you have a one-on-one session with a counselor, you know, after this session, can really help you drill down to figure out which one of these plans might be the right fit for you. Like any insurance product, rates vary from one insurance company to another. You know, if you go get quotes on your auto insurance or homeowners, they're all over the map. Same thing with these plans. One thing that does affect it is age. These are age-based plans, so the older you are, the more it's going to cost. Men pay slightly higher at the same age than women do. If you're a tobacco user, you're going to pay a little bit higher as well. Of all those plans that were listed on that slide a couple ago, you could get one as low as about $40 a month, up to almost $200 a month at $65, depending on how much you wanted them to cover. Okay? Most people pick somewhere in between those two numbers. Okay? And rates, you got to figure that rates are going to change annually. We age, and they're age-based plans, so every year you can expect an increase. This is good for travelers, meaning original Medicare doesn't have any networks. You can go anywhere in the U.S. This works right along with it. Okay, so we talked about secondary insurance options, retiree options, and Medicare supplement plans. Any questions on that box before we go to prescription drugs? All good, Mark? All good. Thank you. Okay, last piece, if you have original Medicare, you have your A and D, which is your primary health insurance, inpatient, outpatient. You picked up a secondary insurance to help pay those deductibles and co-pays that we talked about. The last thing you need is something to cover your prescription drugs. And that's where you'll need to purchase a Part D prescription drug plan. So these are sold by private insurance companies, but they all have to be approved by Medicare. It says approved by CMS. CMS is Centers for Medicare and Medicaid Services. That's actually the official name for the Medicare department of the government. Okay? So anything that is a Part D drug plan is by definition has been approved by Medicare. They're all structured similarly in that they have a monthly payment, a premium to pay to have the plan. They have co-pays when you pick up a prescription typically, and many of them have a deductible. Although the deductible for a lot of the plans only applies if you're taking brand name drugs. They typically don't apply it to generic drugs. The way the plans are structured is If you are taking a drug that has a deductible, then you have to meet the deductible first on that brand name drug. The maximum deductible is $615 this year. Medicare sets that, and then each insurance company decides where they want their particular deductible. A lot of them are at $615, okay? So my wife takes a brand name drug, so every year come January, we have to pay the full amount of that drug in January and February until we've hit this deductible, okay? I just take generic, so I don't have to, I skip right over that deductible part. And then you're in the initial coverage phase. And in the initial coverage phase, you're going to pay a set copay based on what tier level they've assigned that drug. So if you're taking a generic, it could be a zero copay, you know, or $5, or it's going to be something relatively low. If you're taking brand name drugs, your copays, even once you're past deductible, might be $45, $55, something like that. And then there's higher tiers above that for the real specialty drugs that you see advertised on TV to call your doctor about to see if you can get them. One important number here is $2,100, okay? It says it ends once you've spent $2,100. So if the deductible and your copays for your Part D plan hit $2,100 in 2026, then you will have no more copays for your prescriptions for the balance of the year. I know some people who are taking some very expensive prescriptions and have hit this number in April or May, okay? So once they hit that 2,100, their prescriptions for the rest of the year are zero. That is the worst case scenario for Part D drug plan. Okay, so we've covered all the boxes under original Medicare. And again, that has no networks, so you can go anywhere you want. Okay? You have your secondary insurance and your drug plan. Any questions on anything about original Medicare? Okay,
Wait, I actually have a question.
go ahead.
Are you required to have a drug plan? What if you don't take any meds?
You should get a drug plan. Are you required? No, no one's going to show up at your house and make you get a drug plan. However, you probably would want to get a drug plan with the lowest monthly premium, which is about like $6.50 a month in 2026. The problem is you will probably eventually need a drug plan. And if you decide not to get one when you're first enroll in Medicare, when 3, 4, 5 years later, when you now need one, you can only sign up at certain times of the year, and you're going to have a late enrollment penalty that'll stick with you for the rest of your life. So it's definitely worth, even if you're not taking a prescription, just pick the least cost premium plan that's cheaper in the long run than running into a late penalty later. Okay, we'll now jump over to the other choice. Okay, instead of original Medicare, a choice you have is to enroll in a Medicare Advantage plan. Okay, you do have to already be enrolled in Part A and B. Those are the two main parts of Medicare. Everyone has to enroll in those, whether you pick original Medicare or an Advantage plan. Everybody will get A and B. But one of the key things that differentiates Advantage plans is that they are all network driven. These are managed care options, okay, run by insurance companies, okay? You know, Independence Blue Cross, Humana, Aetna, they all have them, okay? And so that's one of the key differentiators in there. They all have networks. So they have lists of doctors, hospitals, therapists, etc. that you should, in order to maximize your benefits, you need to stay within the network. So if you do decide to pick an Advantage plan, it's important to understand that you're still on Medicare. You're still getting your Medicare benefits. You've just decided to get them through a private insurance company instead of having them administered through the government's office of CMS. So effectively, when you pick this option, you're asking the government to just outsource the management of your Medicare benefits to this insurance company that you've selected. And the government will gladly do that. It's easier for them just to write a check to that insurance company every month and say, okay, now he's your problem. Okay. So they'll gladly do that. One of the key things, as I mentioned, is the network of doctors and hospitals. So as you're looking at these plans, as you're considering these, key thing to do is really make sure, any plan you're considering, that all the doctors that you have are in the plan. Most people our age really aren't interested in switching doctors because they're not in network. Okay? So doing the due diligence right to make sure who's in and out of the plans is important. And you also want to think about hospitals. I mean, you don't think about that until you got to go to the hospital. But you should think about what hospitals do I want to make sure I have access to in network in case I end up in a hospital. So you'd want to check that out as well. Some of the plans have a monthly premium. Some have zero premium. Okay? Now, as I mentioned, you have to have Part A and B already in order to pick an Advantage plan. So you're paying the premiums for Part B, that $202.90 a month. You can't avoid that with either option. So you still pay that. But many of the plans don't charge a premium over and above that for many of the Advantage plans. Instead of paying a premium, these are more what I call pay-as-you-go plans. So you're not going to pay a premium typically. There are premium ones out there, but most people don't pick them. It's kind of pay-as-you-go. So with most plans, you have an out-of-pocket cost for each service you use. If you go see your primary care doctor, maybe it's $5. If you go see a specialist, it might be $50. If you go get some x-rays done, you know, it might be $75. If you get an MRI, it might be $250. If you end up in the hospital, it might be $350 a day for the first 5, 6, 7 days. Okay, so out-of-pocket cost for each thing. And you're not allowed to have a Medicare supplement plan here. They're not allowed. So they truly are out-of-pocket cost. So even though you're not paying a premium for most plans, how much is it going to cost you for the year really is a function of how much health care do you consume. If you have a real healthy year, only go see your doctor a couple times on routine stuff, it's going to be very low out-of-pocket option. Okay? If you have a disastrous health year, however you want to imagine that, okay, it can be quite a bit out-of-pocket. And most Advantage plans include a prescription drug plan. It's built into it. You don't have to pick which one do I want. They have one already built into it. There's a couple different types of these Advantage plans. Health maintenance organizations and preferred provider organizations are the two main ones. Health maintenance organizations, what that means is you have to stay in network. Okay? If you want them to pay for anything, you've got to stay in network. The only exception is emergencies. By federal law, all Advantage plans have to cover you if you're out of network, if you have an emergency. Maybe you're out of the service area, you fall and break your leg, that's an emergency. You're going to a hospital, you may be out of network, but your plan still has to cover you because that's an emergency. Okay? They'll probably want to get you back to one of their facilities as soon as practical, but it would be covered. With preferred provider organizations, you have some options to go outside the network. So maybe for a particular specialist, you can't find the one you really want in network, you can go outside the network. Okay? You're going to pay more for it. Okay? So if normally they would cover roughly 80% of cost in network, if you go out in network, maybe they're only going to pay 50 or 60%. Okay? And it might be just a more expensive plan to have, but a lot of people just appreciate the option to be able to go outside the network. They're willing to pay a little more to get that. There are some special needs plans. These are specially designed for certain criteria, such as some people qualify for Medicare and Medicaid. Okay? So there's some special plans that are designed to meet that particular audience. There's some others that are designed to fit certain chronic illnesses. One of the advantages of Advantage plans is that they can offer additional benefits that original Medicare does not offer. There's a list of benefits that the government has approved that the Advantage plans can offer. They're not required to, but it's a very competitive business from one insurance company to another. So most of them all offer the same type extra benefits to compete for your business. Most offer dental coverage. Certainly routine coverage, 6-month checkups, cleaning, x-rays, and maybe an allowance towards something a little more expensive. Now remember, it's all network driven, so you have to go to dentists who are in their network. Okay? Often they offer some reduced price hearing aids, vision. They often offer an annual vision exam and maybe an allowance towards glasses or contacts. Some offer transportation to medical appointments, a certain number of them per year. Maybe meals brought to your home after a hospital stay. And over-the-counter benefits. Most offer a quarterly allowance, maybe $25 to $50 a quarter, that you can use to buy over-the-counter items, healthcare related. So you can buy your ibuprofen and your toothpaste and your Band-Aids and your vitamins and things like that. And they're all required to have a maximum out of pocket. What that means is, as I talked about earlier, these are kind of pay as you go. So you're going to have out-of-pocket costs for each level of service. If you have a really bad health year, you could be out a lot. So the maximum out-of-pocket sets a cap. If you hit that cap during the year, you're done paying medical copays for the year. Okay. Now, for most of the plans people choose today, the zero premium ones, the maximum out-of-pocket is usually around $7,500 to $8,500. So the good news is there is a cap. It's not unlimited. Okay. But it's a fairly high cap. Okay. Not many people are going to hit that. You have to have a really bad health year to hit that. But I've seen people hit that. You know, you really have to have something. I'll give you an example. Maybe you're diagnosed with cancer and need chemotherapy treatment. Chemotherapy can be very expensive. These Advantage plans will cover 80% of that, and you're responsible for 20%. So 20% of a big number, and each treatment, okay, can add up. So if you have something like that going on, that's kind of where you might hit the maximum out of pocket. I'm not going to read through all the bullets on this, but you all will have a copy of this later if you don't have it already. On the left-hand side, it shows the original Medicare option, including purchasing a Medigap. And what it lists is some of the pluses and minuses of that choice. And on the right-hand side, it lists Advantage plans and some of the pluses and minuses of that choice. So this is geared for you to look at, and again, it may hopefully be helpful in making that decision, which one's right for me. Okay? One other thing I want to touch with on Advantage plans, because it's on the up near the top of Advantage plans, it says may require pre-authorizations. I do want to touch on that. Advantage plans are managed care, and you will run into more pre-authorizations required with them. Okay, so it's not on routine stuff, but as you get into more expensive tests, more expensive procedures, you're going to run into more situations where the insurance company has to approve it prior to moving ahead with your doctor's recommendation. And you'll also run into more denials of service with those authorizations than under original Medicare. Right? Don't let that scare you away. Anytime you're denied a service, you'll be provided information on how to appeal. Okay. With the first round of denials for Advantage plan, there's a surprisingly high rate of that being overturned on the first appeal. Okay. So, but it's just kind of a fact of life of that option. So just understand it. Okay. So we finished up talking about Advantage plans. Any questions on Advantage plans?
Gary, there is a question in chat from something earlier. If you're prescribed meds in the hospital, is that against your hospital costs or Part D plan?
Good. That would be covered under Part A as part of your hospital cost for the meds that they prescribe for you while you're inpatient. It does come from the hospital pharmacy, yes. Okay, the next thing we'll talk about, so that's really, we've talked about the different insurance pieces. Okay, the next thing we're going to talk about is how and when to enroll. I wish it was real easy. You'd think it would be. Okay, it's not. And so paying attention to how and when to enroll is important. Okay, so you don't miss a window and end up with a problem because of that. Okay. So the first thing we talked about earlier was Parts A and B of Medicare. So we're first going to talk about how to enroll in Parts A and B, because everyone's going to need that regardless of which option they pick. This shows a couple different scenarios here. Okay, if prior to turning 65, you're collecting a regular payment from Social Security, okay, then you're going to be automatically enrolled in Medicare Part A and B and sent your card about 2 months prior to your 65th birthday. So you might be getting early retirement. You can take that as early as 62. Maybe you're getting Social Security disability. Any regular payment from Social Security, you're going to be automatically enrolled in A and B. You won't need to do anything, and it'll show up in your mailbox about 2 months before your birthday. Now, if you don't want Part B, there's a form in there to show you how to turn down Part B. Okay, you might, or spouse might still be working, and you may have group coverage, so you don't need to pay that monthly premium for Part B. You can decline Part B at that point, and they explain how to do that. But assuming you want it, the card's going to automatically show up, and you'll have that prior to your 65th birthday. It would be, the effective date's going to be the first of the month of your birthday month. So if you're born on the 18th of the month of July, and you sign up on time, or you get automatic enrollment, it's going to be July 1st will be the effective date. It always rolls back to the first of the month. There's exception for every rule with Medicare, at least one. An exception there is if your birthday's on the first of the month, if it's July 1st is your birthday, yours is going to be effective June 1st. It rolls back a month. So, now, if you're not receiving Social Security benefits prior to 65, and if you want Medicare at 65, if you need Medicare, then you need to go through an enrollment process, okay? So the easiest way to enroll, if you're comfortable using computers, is online on the Social Security site, ssa.gov, and then there's a big section in that site for Medicare, and there's online applications, okay? That is probably the best way to do it if you're comfortable doing that. If not, you can set up an appointment at a Social Security office or to do it over the phone with Social Security. Getting either one of those appointments, you might be a month or 6 weeks out, so you just need to, plan accordingly. Okay, so that's how to enroll in A and B. When should you enroll in A and B? Okay, the left side of this talks about, let's say you need full Medicare at 65. Okay, you want it as soon as you can get it. Okay, so you can actually go on the Social Security site and enroll 3 months prior to the month of your birthday. So if your birthday's in July, you could enroll June, May, April. So April 1st, you could actually go online and enroll. It's not going to be effective to July 1, right? But you can go ahead and get the enrollment out of the way 3 months early. You can enroll the month of your birthday, or you can enroll 3 months after your birthday. Anytime in that 7-month window is called the initial enrollment period, and you won't have any late enrollment penalties. Okay? Now, if you want it effective as soon as possible, the first of the month of your birthday month, then you need to do that enrollment before your birthday month. Okay? Strongly encourage people to do it 2 to 3 months prior to your birthday month. Go ahead and get that part done. Everyone's going to need A and B, no matter what your choice is about Advantage plan or not. So get that part done. That gives you more time to meet with a counselor, decide what plans you want, what drug plans, what Advantage plans. So get that out of the way. Now let's talk about the right side of this is maybe you don't need Medicare at 65. Maybe you're still covered under a group health plan, either through your employment or a spouse's employment. Okay? If that's the case, covered by a group plan, as long as it's via active employment, you're not sitting at home in some work reduction plan or something, you're actually going in and actively working, and you're with a company of more than 20 employees, that's important, okay? Then you don't have to sign up for Medicare A or B at 65. You can defer them both because you're covered by a group plan. And as long as you're covered by a group plan, you don't need to sign up for either one of those. And if you work till 95 and still covered by a group plan, that's fine. You'll be able to enroll in Medicare at 95 when you finally retire, okay, without a penalty. Now, many people in that situation, covered by a group plan, going to keep working, that's fine. Many still enroll in Part A only. A only. Why A only? Yeah, because there's no premium for A. People don't have to pay a premium for A. So, doesn't cost me anything. They have group coverage, well, they might as well sign up and, you know, it's free for me, right? So a lot of people do that anyway. So if you do that, it's secondary to your group coverage. If you're hospitalized, your group coverage is going to be billed first, but maybe Part A would cover something that your group plan didn't cover. So that's why a lot of people go ahead and get A. Now, the one exception there is where you may not want to get A is as part of your group plan if you're contributing to a health savings account. Okay? If you sign up for any part of Medicare, including just Part A, you can no longer contribute to a health savings account. Okay, so that's the one caveat to be careful of there. Healthcare marketplace, the ACA. In Pennsylvania, the marketplace is called Penny, penny.com. If any of you currently have your insurance through Penny, this slide tells you it's very important to switch over to Medicare as soon as you can. So the month you turn 65, get off Penny and get on Medicare. Okay? Many people on Penny receive a subsidy, reduced premiums. Once you're eligible for Medicare, those subsidies go away. And the Penny insurance would be much more expensive than Medicare. So switch over, don't say I love my Penny plan, I'll keep it to the end of the year. You need to switch over as soon as you're eligible for Medicare. The next thing we talked about earlier after A and B was supplements, Medicare supplements for original Medicare. We're going to talk now about how and when to enroll in those. First thing you have to do is decide which one of those plans I want. There's a whole bunch of them. They cover different amount of those deductibles and copays and have different premiums associated with how much they cover. So this is where meeting with a counselor can really help you out, one-on-one meeting, look at the different plans, look at the premiums for the different plans, figure out that right balance for you in terms of amount covered and amount I'm having to pay for a premium. Then when you're ready to enroll, this is the one piece of everything we're going to talk about tonight that you can't do on Medicare.gov or SocialSecurity.gov. These plans, once you've decided what you want, you need to enroll by either calling the insurance company directly or working through a licensed insurance broker. These Medigap policies are, from an insurance perspective, like auto insurance or homeowners, you have to buy them through a licensed insurance representative or directly with the company. So when should you buy a Medigap plan? This timing is very important as well. For those picking original Medicare, if you're going to get a supplement as well, most people set it up so their supplement starts the same time their Part B starts. So if Part B starts, you know, August 1st, they want their supplement to be there August 1st as well. Makes sense. And that's what most people do. Okay? But let's say you didn't do that. It would be important to think about buying one within 6 months of that Part B date, because there's what's called an open enrollment period for 6 months from your Part B effective date when you can buy one of these with no medical questions asked. You can be the sickest person in the world, but during that 6 months, you could buy a supplement from any insurance company at their standard rates, no questions asked. Okay. So, but maybe you didn't decide you didn't want one then. You know, 2 years later, you decide, you know, I should have got one of those supplements. I think I'm going to apply now. You can. You can apply for one anytime if you don't have one. Okay? But if it's after 6 months from Part B effective date, the application is going to include health questions. When you're last hospitalized, what you've been diagnosed with, what meds you're taking, and based on your answers, they can deny you coverage. Nope, we don't want you. Or they can accept you and charge you a higher premium because of your medical conditions. Okay. So that's one of the advantages, if you're going to get these, to buy it either initially with your Part B or within the 6 months open enrollment period. That eliminates that risk that, you know, gee, maybe I might not pass the test, the underwriting come later. Because none of us know what our health is going to be down the road, right? Okay, so now we're going to talk about Part C and Part D. We have Part A and B, and then if you decide to get original Medicare, you're going to need to pick a Part D drug plan. If you decide to do Advantage plans, you need to pick an Advantage plan. No one's going to be getting both of those. You're going to get one or the other. But we're going to talk about them both together on this slide because the process is the same. Okay? First, you need to evaluate the plans and decide which one's best for you. Excuse me. What are the benefits of the plan? What does it cover? What does it cost? What's the formulary? Formulary means the drugs they cover. Do they cover my meds that I'm taking? Very important. Okay? If you're looking at an Advantage plan, what are the extra benefits? And you're comparing that with other companies that offer. Who has the best? Maybe dental coverage is important to me. Who has the best, most comprehensive dental coverage? Let's look at that. Okay. And again, a one-on-one with a counselor can help sort through this. All the information about the drug plans, all the information about the Advantage plans are in the plan finder on Medicare.gov. You can go in there and look at it. Anyone can. But it's one of those things, there's so much information there, it can be overwhelming to sort through and try to figure out which of the 75 Advantage plans you want. Okay? So we definitely can help filter that out for you. Once you've decided, yes, I want that drug plan or I want that Advantage plan, if you are using the Medicare Plan Finder, there's a green button that you click that says enroll. 3 screens later, you're enrolled. It's a very simple process. Okay? Now you can also call the Advantage plan company or the drug company. Maybe you think that's the plan you want, but you got a couple questions. You could call them, get your questions answered, and then enroll right over the phone while you're talking to them. Or if you're working with an insurance broker, they'd be able to help you with that as well. When do you want to enroll in the drug plan or the Advantage plan? Most people do it 1 to 2 months prior to when they need it. Okay? And again, it's normally done to coincide with the same time your Part B Medicare is starting. All right, now let's talk about signing up for Part B. If you didn't sign up at 65 because you were still working, you were covered by a group plan. And now 5 years later, you're 70, you're ready to retire, what happens? Okay? You'll be given a special enrollment period of up to 8 months after your group coverage ends or active enrollment ends in order to enroll in Medicare. 8 months is a long time, and that amount of time is irrelevant for most people. For most people, most companies, if you leave, July 5th, your medical benefits are probably continued through the end of the month only. Okay? So the fact that you have 8 months is kind of irrelevant. You need it effective the first of the next month. Okay? So, but if you know you're going to be retiring then, you can go ahead and do the enrollment forms. There's 2 forms. You can do this online as well. The one form you can't do online is the L564. And that's a form that you would print out and give to your employer. And they would fill it out and give it back to you. Okay, or your spouse's employer, who's ever covering you. And what they're going to fill in is they're going to verify that you've been covered by a group plan ever since you were 65. And that gives Social Security, they don't care how old you are now, you signed up for Medicare, as long as they can see you've been covered by a group plan, no late enrollment then. That's what gives them the information to know that. So you can do the application online and then upload that form as part of the application, or you can take those 2 forms together and take them down to a Social Security office. Now at that time, when you're finally retiring at 70, you're also going to need a drug plan or an Advantage plan. So again, you're going to be making that decision at that point as well. However, you only have 63 days, not 8 months, to make that decision. Why is it different? Nobody knows. Why is it 63, not 60? Nobody knows. Okay, it just is. Okay, but again, even 63 days is more than most people need, because again, your benefits are probably going to stop at the end of the month, so you're going to need it effective the first of the next month anyway. So as long as you're on top of when you're retiring, get with the counselor to pick the plans you want, and get the enrollments done. The number of days is kind of a moot point. Again, you can enroll right on Medicare.gov for these plans. Okay, general enrollment. General enrollment period is for people who didn't attend this presentation and didn't understand that they need to enroll within certain windows. Okay, so Or maybe you understood that, but you were on a world cruise for 6 months and you missed when you were supposed to enroll, okay? So if you missed your supposed enrollment period, you'll have to wait to the next general enrollment period. And that's January, February, March of each year. So you can enroll then, if you missed your appropriate one, and it'll be effective the first of the month after you enroll. So if you enroll in January, it'll be effective February 1st. However, if you're having to wait to the general enrollment period, that means you messed up, and you may have a late enrollment penalty, because you're having to wait for this general enrollment period to come around. Late enrollment penalties typically apply to B and D, is most common. They're a monthly charge in addition to whatever premiums the plans are that you enroll in. Let me give you an example. If someone is 12 months late in signing up when they were supposed to, for both B and D, they would have a late enrollment penalty of $17 for Part B and $4 for Part D, which doesn't sound like a huge amount, but that's the monthly late fee every month for the rest of your life. Okay, that can add up to thousands of dollars. So you really want to not be subject to a late enrollment penalty. Yes?
So, and you may be getting to this on the next slide. So I am covered by my husband's insurance. I'm 71, I'm gonna be 71. So I have not signed up. Yeah, I have.
Sure.
But I have not signed up
Right.
because I'm covered. So when he retires, or if he loses his job or whatever, don't I get some kind of special window?
You both will. Okay, so whenever he retires, you both will have a special window to enroll in Medicare without a penalty.
Even me, because
Both of you.
he's not 65 yet, but
Oh, okay. Yeah, so
Right.
yes, you'll get a special enrollment.
I will.
That form will gonna have to be sent to his employer.
the
Okay.
CMS.
Yeah, the
Yeah,
form, the
okay.
form to show that you've been covered by a group plan
Perfect.
ever since you were 65.
Okay.
And so you won't have a late enrollment penalty.
Okay.
Okay, you know, if you go home tonight with just a couple takeaways, I hope this is one of them. This is one of the most important periods for anyone on Medicare. It's the annual open enrollment period. It's the same time every year, October 15th to December 7th. That's when you can look at the plans that are going to be available, the Advantage plans and the drug plan, for the coming year in January. And it's very important every year to sit down with a counselor, or you can do it yourself if you're comfortable on Medicare.gov Plan Finder, to look at the new plans that are coming out in January, or the revised plans, and see if it makes sense for you to change plans. If you get complacent with your plan, oh, my plan's fine, I'll just stick with it, okay? When you finally do sit down one of these years and look at the open enrollment, you'll probably see it's been costing you a lot of money that you didn't have to pay, or you missed some benefits that you could have had. So even if you love your drug plan, you love your Advantage plan, sit down and look every year at open enrollment, because every plan changes every year. Every plan makes changes. They change the premiums, they change deductibles, they change the co-pays, they change the drugs they cover, they change who's in their network. So if you're not paying attention, okay, things are changing all about you, okay? So take it as something you're going to do every year, to sit down and reevaluate the plans. And other plans are changing too. So another plan may have changed some things that are now more advantageous for you than last time you looked at it. Another open enrollment period, this is a special one for anyone who has a Medicare Advantage plan. During January, February, and March, you could make a change during that period or switch back to original Medicare. This is really seldom used. I've been doing counseling for about 11 years. I think I've had 2 people do this. And it's really when you screw up. So in both cases I've had someone enrolled in an Advantage plan in the previous open enrollment period to start January 1st. After January 1st, when they went to make an appointment with their doctor, that's when they realized the doctor was not in the network that they enrolled in. So it's like a get out of jail free opportunity to switch to a different plan. There's some other special events where you may have an opportunity to change plans during the year, but they're really event driven. If during the year you qualify for a federal or state assistance program, you'll be given special times when you can change. If you move outside the service area, your plan may not be available in that area, and you'll be given an opportunity to change. If you lose some coverage that you had, like maybe you have an employee retirement plan and they do away with it, you'll be given special enrollment opportunities. Speaking of assistance programs, this slide touches on three main ones. Medicare Savings Programs is a federal program to help people who have limited income to them. It helps pay for the Part B premium. It helps pay for deductibles and cost sharing for Parts A and B. Okay? The Extra Help Program in the middle is also a federal program that helps reduce prescription costs, pays drug premiums and co-pays as well. Both of those look at two things. They look at your income and they look at your financial resources, meaning money in the bank, investments, IRAs, anything like that. So you have to qualify both on income and financial assets to achieve those. The last one is a Pennsylvania program called PACE and PACENet, and it helps with prescription costs. Okay? It only looks at income. It doesn't look at financial resources. And it also has the highest income threshold of any of these that we have up here. The PACE one for a single tax filer is around $33,000 per year, and for a couple it's about $42,000. So if you know anyone or yourself are in those limits, you should meet with a counselor and explore what options you might qualify for. If you qualify for these, you definitely want to get enrolled, and we can help you do that. Okay, so this is kind of the wrap-up slide here. We're back to the original roadmap, original Medicare on the left, Advantage plans on the right. Any questions on any of these areas that we've talked about tonight?
There's a couple of questions that have been in chat here. One relates to HSA and not being able to contribute to that. Does that include the spouse, if working spouse contributes to an HSA?
With the HSA, so there's only, well, it might be family contribution, there's only one employee, one person is the employee who is actually making the contribution, okay? So if that person signs up for Part A, then they can no longer contribute to the HSA. Okay, if the non-working spouse, okay, they're not contributing to the HSA themselves, okay, they can sign up for A without an impact on that.
And the second question, husband turns 65 and retires. Do I need to enroll with him for Medicare B? I only have Part A presently.
If you're 65, then if you don't have some other health insurance, then you would need Part B and the rest of Medicare, or else you wouldn't have full health insurance, it sounds like, and you would have a penalty if you didn't enroll soon, if I understood your question correctly.
I think it's the same thing that we have.
Oh.
She would need that form to prove that she was covered under the other thing.
Yes, okay. Yeah, so if you had group coverage through your spouse, you would need to get that one form we talked about to document that. Did that answer your question?
Wendy, yeah, you can respond. Let me know if that answered. There's another question that came through on chat while we're waiting. I signed up for Part A. Oh, Wendy says yes. Thank you. Thank you. I signed up for Part A, turning 65 in July. I need to sign up for Part B by October along with Part D, is the question.
Could you read that again?
I signed up for Part A, turning 65 in July. I need to sign up for Part B by October along with Part D.
Okay. I'm not sure why you need to sign up for October. Maybe your work is, you're discontinuing your work coverage at that point. If you turn 65 in July and you signed up for A, I guess you didn't need Part B then. So you must have some form of coverage now, and it sounds like that's going away in October. So.
Yes, he says.
Okay. Okay. Yeah, so you certainly could get B starting in October. You definitely would want to sit down and talk with the counselor one-on-one to make sure you get the timing right here, since you're just a couple months apart between A and B. It can get a little confusing. So please, call your nearest senior center in Chester County and get a one-on-one appointment with one of the Medicare counselors, and they'll be able to walk you through that. Yes.
So I haven't, you may know the answer to this, but he will be retiring before he reaches 65. So if he goes on to COBRA until he hits 65 with his work, how does that affect me?
Well, it doesn't. You can go on Medicare, right?
At that time?
You can go on Medicare.
Yeah.
And you can go on COBRA or get Penny, go through Penny or whatever options are open to you, but you can go right to Medicare.
Okay.
Okay, 2 other quick slides, and if there's any other questions, I'll certainly take them. This is one we showed earlier. It's just a reminder of how to reach out and contact us. All our services are free, and again, you can get a one-on-one appointment by just calling the nearest center that we do counseling, all the senior centers in Chester County, so whatever's the closest for you, you can call them up. It is only by appointment because they're not there every day. And also, if you just have a quick question or need some guidance, call our helpline and leave a message, and a counselor will get back to you quickly. And the last thing is kind of an advertisement for the Department of Aging. As I mentioned, all the counselors with PA-MEDI are volunteers with the Department of Aging. The department uses volunteers in several other areas, as you can see on this slide. So when you are retired, if you're looking for some volunteer opportunities, keep the Department of Aging in mind, please. If there's any other questions, so glad to take them. Otherwise, I'll thank you all for coming.
Thank you.
Anyone on Zoom? Last call.
My light is calling, I'm understanding a
Good.
lot more.
Good.
And again, those of you who signed up, you'll be getting an email from me after I clean up from here with all the handouts.
Thank you for volunteering your time to explain all this. We really appreciate it.
Oh, you're welcome. Thank you.
Yeah.
Thank you for joining us. Okay. Good night, everybody.
You were there.